Hello again. Today on our Health and Science Focus, we are talking about breast cancer. As we know, October is Breast Cancer Awareness Month. Now, experts warn the mortality rate for non-communicable diseases is on the rise. Now, these includes cancers. The most common cancer among women in this country is breast cancer, as we know. Cervical cancer is, however, said to be more popular among black women, followed by breast cancer. Let's chat more about this. Dr. Fundile Nyati, CEO of Proactive Health Solutions. Just to put it in context for us, Doc, a very good morning, and thanks so much for your time this morning. So what are the stats telling us? Just a very quick layman's idea of what the stats tell us when it comes to cancers, in particular breast cancer and South Africans.
Well, I'm just going to talk generally. You've just mentioned now, firstly, that in South Africa, but also in the rest of the world, we've got a growing problem of non-communicable diseases, that is, non-infectious type of diseases. And what we see on an annual basis in South Africa is that of these non-communicable diseases, when one looks at the, let's say, the natural deaths in South Africa, more than half, about 54%, are actually non-communicable diseases. And within that group of non-communicable diseases, the cancers are, occupying a big percentage. So cancers in general in South Africa are becoming a problem. Now, we are in the breast, awareness month, which is October, and you've just mentioned that breast cancer is the most common type of cancer amongst women in South Africa, followed, by cancer of the cervix. So that is what the stats are telling us in South Africa. Now, but if one goes further and look at the different race groups in South Africa, as much as the black population are in the majority, in South Africa, however, when one looks at the cases that are diagnosed with breast cancer, you tend to see the white population, the Indian and the colored population, being more, diagnosed with breast cancer as compared to the black population. Now, obviously, there's different thinking around that. What we normally see also is that the black Africans or the blacks tend to present quite late with breast cancer, which is then the problem. So the question then is what we see that the blacks, tend to present late, is it not a factor of awareness? Is it not a factor of access, to healthcare services? So, but the key message, though, is that we have a rising population of people who are presenting with breast cancer, but more worrying in the black population is the late presentation, where sometimes it's already late to administer certain interventions that will save lives. And that is the problem.
Dr. Nyati, you've explained this in the context of women here. Are we seeing, do the same explanations hold for men who are diagnosed with breast cancer, or the numbers that we are seeing there?
Yes. Dr. Carol Ben, earlier did touch on the fact that, this is a cancer that is non-sexist. Meaning males and females do get this cancer. Actually, I was Dr. Carol Ben's patient in year 2001 because I presented with a breast lump and all the tests that were done could not rule out that it was not a cancer up until I had to go under the, the scalpel, and for her to remove the lump. And luckily for me, it turned out that it was not cancerous. So we have a situation where there's low awareness amongst men about the fact that breast cancer is not only a problem of females, it does affect males as well. And so I was talking about low awareness amongst women with the late presentation. It's even worse with men because, most people don't think about the possibility that a lump, on a breast of a male may actually be cancerous.
Well, Doc, I'm so glad that yours turned out to be non-cancerous, so that we are able to chat, but you are able to chat from a very informed perspective this morning as well. So Dr. Ben also spoke about breast cancers, saying that they don't kill people. It's breast cancers, though, and what they could lead to, I think, is that the problem? Am I correct in deducing that?
Well,
or where they might spread, where it might spread to?
Yes, I think that is the problem, because I mean, at the beginning it starts in a locality. In this case, it starts within the breast, and it grows within the breast, and then it spreads to nearby, tissues. And the problem comes when it actually gets to be taken to other parts of the body, especially the liver, the lungs, and also the spine. And complications arising from where it has spread to normally is what may lead to actually, death, especially if it is diagnosed quite late.
All right, so which are the sort of, if I have to call them the usual suspects, which are the sort of dangerous ones that breast cancer could lead to or could spread to? We speak of the liver, we speak of the lung. Is there anything else?
Well, yeah, I mentioned the liver, I mentioned the lungs, and the lungs, it's a problem there because, there's high, vascularization. There's a lot of blood within the lungs because their function obviously is to oxygenate, blood that is, that needs more oxygen. So when stuff, spreads to the lungs, then the chances of that spreading to other parts of the body becomes quite high. But other people, like I said, it may spread to the spine, and then you get somebody presenting with, we call them secondaries on the spine, which may lead to fractures of the spine. And sometimes those fractures may actually then create a problem with the spinal cord within the spine, which may lead to paralysis for some people, depending on how soon it is discovered.
Is breast cancer, or cancers in general, but particularly because we're talking about breast cancer today and this month, still a taboo subject, you think? Or do you think, like, celebrities like Angelina Jolie coming out with their stories, talking, lots of our local, celebrities and well-known South Africans as well, coming out, talking about their experiences, sharing their illnesses with us, has that helped break those barriers?
Well, the example we've just mentioned now about Angelina Jolie. In fact, now there's a lot of other, people in the medical world who are actually looking at her example, because she was somebody with a strong family history of breast cancer. Yeah. And when she went and tested and found that indeed she's got the genes that increase the chances of her getting a breast cancer, she went and removed her breast even before there was a problem. And so, but through her doing that and her stature as a celebrity, so many people got to be aware, of breast cancer and its dangers, and the fact that family history is very important. And I was happy earlier to hear Dr. Ben also talking about that it's important to know your family history, especially if somebody was diagnosed much younger with cancer, because that could be a risk factor. So yes, the contribution by people who are celebrities in terms of increasing awareness, and also people who are survivors of breast cancer, that goes a long way in terms of dealing with the social stigma. There is a lot of social stigma still, that we find in our communities, and in some instances there's also belief systems, that may actually cloud the understanding of this. In South Africa, we've got, for example, Umamu Dube, the one who normally does the adverts for one of the insurers.
Lillian Dube, yes.
She's a survivor, and she's doing a great job, because she's not talking from theory. She's talking from a point of, I went through this, and this is how, my mind was working at the time I was diagnosed, and this is what happened when I needed to have surgery and all of that. So you really need people who have gone through this experience to testify and share their stories. And in Black communities specifically, storytelling is a very good way of increasing awareness. Sometimes a Dr. Nyati can come and rattle a lot of information in front of the people, but they will take more out of somebody like Lillian Dube, sharing her experiences. So storytelling, we need to use more of storytelling to be able to increase the awareness about the symptoms of breast cancer, awareness about the need for self-breast examination, which Dr. Ben did very well. Also awareness about, if you pick up something, where do you go to seek help? because all of that will help in the early diagnosis and appropriate treatment, which may then, not necessarily lead to people undergoing surgery.
Yes. Thanks, Dr. Fundile Nyati. Thank you so much for that, and what a candid discussion there, and also talking about his own experiences and talking about, people who are talking about their experiences. We need more and more people. A very special guest coming up, special to me and my heart, my colleague Lebo Kobola, living proof that you can beat this dread disease. We have worked for many years together. We've been on the road together as well, and I had no idea. She's such a tough person, and she's still tough. We're going to talk to her, a first-hand account of going through breast cancer treatment.